Staying with matters COVID, the Ministry of Health now says inadequate financial resources are hindering the provision of COVID-19 treatment and isolation programs across the country. This admission comes as scores of clinical psychologists hired to offer psychosocial support to COVID patients step up demands for full payment of allowances accumulated over the last 8 months. Anita Nkonge, I hope, will tell us what the Ministry of Health has done with all the millions we've had that have been allocated towards COVID.
At the height of the COVID-19 pandemic in 2020, the government hired 114 clinical psychologists to various treatment and isolation centers. They were deployed to their stations in August 2020, but months later, the medical staff say allowances attached to the role have not been paid. John, not his real name, is among them.
We have been receiving our salary as councillor too, and we've been missing all the other allowances that were written in our contracts. And this is because there's no designation called clinical psychologists in the country at the moment. And they say they're going to work on it, put all our data there, and then start paying us as clinical psychologists. But that has not been fruitful. We've been following up with the SRC, the Ministry of Health.
According to this appointment letter obtained by NTV, part of the contract agreement was that each clinical psychologist would earn a basic salary of 31,270 shillings, alongside a health service allowance of between 15,000 to 20,000 Kenyan shillings, emergency call allowance of 10,000 shillings, a health risk allowance of 3,000 shillings, and a commuter allowance of 4,000 Kenyan shillings. In this February 2021 payment record, only rental and commuter allowances were paid to this medical officer, alongside the basic salary. Other critical allowances attached to the risks were not paid.
So we started inquiring from November, December, up to now. So it's been back and forth between the ministry and the SRC. Although the SRC they have responded and they approved that we should be paid those allowances, given the fact that we are working in isolation units. But now the ministry, we have had issues with the ministry, particularly the human resource manager at the Ministry of Health. And he's been saying that there was a problem, there was an error, a typing error. So all those letters, 114 letters, were wrongly typed. Somebody copy-pasted those allowances and placed it on our contracts.
John says the worst fears came to pass nonetheless.
People contracted COVID at their workplaces. Yeah, we've had like 7 cases that have been admitted.
But the government admits that resource shortcomings may be hampering medical programs.
Yes, I'm aware that there has been some challenges of payment, not just the universal healthcare workers in isolation centers, but even in other areas. But these are issues of resources that we are trying to address at the Ministry of Health.
Anita Nkonge, NTV.